As we come to the end of another busy month here at the Trust, I am pleased to bring you a roundup of stories from throughout August. We kicked off the month with a look at our apprenticeship programme. We heard from Faye Alexander, Head of Education, and Humaid Ahmed, Education Administrator, about the benefits of apprenticeships and their role in supporting career development.
We have a range of apprenticeships available here within the Trust, and these cover clinical and non-clinical roles as well. And the apprenticeships are available starting from level 2 all the way up to level 7. An apprenticeship route gives people that opportunity to further develop their skills and their career all the way up into sort of senior management levels.
I didn't really know about apprenticeships to start off with, because obviously when you hear the NHS, you know about the clinical, you know, the nurses, the frontline staff, you could say, but you don't realise the amount of opportunity you can get from a non-clinical perspective. Both apprenticeships that I've done, it's helped instill a bit of confidence in myself and also in terms of what I want to do going down the line.
We really want our apprentices to do well, because the overall goal is that you will come and you'll do your apprenticeship here, and then you will stay on and gain employment with us at the Trust.
As long as you're always learning, you're always developing, you're always becoming a better version of yourself.
Thank you, Faye and Humaid. We also learned more about our collaboration with Macmillan Cancer Support this month. We heard how this partnership not only supports the training of our new Macmillan cancer nurses at our own trust, but also plays a crucial role in providing comprehensive aftercare for patients once they've left hospital.
In the past, the Trust have identified where things could be made better for people affected by cancer. They'll come to us and put a business case in, and then we'll look at putting that post in. We identified that there's a workforce development issue across the country. Lots of people are coming up to retirement age. Macmillan looked at doing a small programme, and before we knew it, we were offering every trust across Yorkshire and the North East 2 of these development nurses.
I've been nursing since 2010. I always admired the clinical nurse specialist role, and when I saw the job advert, jumped at the chance to apply for it.
We've got a comprehensive training package that people can dip into and dip out of, where there's e-learning, podcasts, virtual learning.
When we work collaboratively, we can pull our resources together and really provide a good standard of care for patients, and also provide a good working environment for the cancer nurses here at Bradford.
Ahead of Organ Donation Week in September, we revisited the story of brothers Shakur Ahmed and Maroof Farouk. Shakur shared how he made a live donor kidney donation to his brother, and we also heard from Razdi Igasan, our specialist nurse for organ donation here at the Trust, who told us about the need for more donors after death, particularly from the Black and minority ethnic community.
I went into hospital. It was actually a very quick process. Before I knew it, I'm back out. But the first thing that came to my mind was straight, has it worked?
The quality of my life increased, and it was a new life. I could eat and drink whatever I wanted. I was a totally different person. Well, he's not only given me life, he's given my wife a life, he's also given my kids a life.
Having him at home has been a massive blessing. Since I've had my operation, I completely forget that I've got one kidney unless somebody mentions it.
Within the Bradford community, a third of the waiting transplant list is from the Black, Asian and minority ethnic groups. Patients have better transplant outcomes if their donors come from the same ethnic background. Around 60% of the families from these communities would decline organ donation. So what we are encouraging everyone to do is to sign on the organ donor register.
Thanks to Raz and to the team. Finally, for the podcast this month, I enjoyed talking to Jennifer Syson, Research Matron and Senior Research Midwife, and Pepper Woods, Senior Respiratory Research Sister, who told me about their fantastic roles in encouraging and engendering a culture of research activity here at the Trust. Jennifer in particular told me about her appointment to the National Institute for Health and Care's Research Senior Research Leader Programme for nurses and for midwives, and how it will bring huge benefits for people here in Bradford, as well as our own healthcare professionals at the Trust who are interested in a career in research.
When I moved to Bradford in about 2006, I'd moved from hospitals where there wasn't a lot of research happening, and I started to notice that there were things happening on labour ward to do with research, and it piqued my interest. And then a secondment opportunity came up to work 1 day a week in the research team, and I thought, why not? I've always been quite interested. And then I just loved it, and it hooked me in, and now it sort of increased my hours and then became senior research midwife.
I believe that sometimes there's a bit of a misconception of what research is. A lot of people, they think you are sat at a computer looking at data, and it's not. It is clinical, it's nursing, you are face to face with patients. But yeah, it is a totally different world, and it's something I think we want to invite people into, just to see, to like get a glimpse of what we actually do, because it is always surprising.
Thank you, Jennifer and Pepper. So to round up, let's have a look at some exciting things that have been happening around the Trust this month. Well, that's about it for this month's update. I will look forward to sharing more stories with you next month. Don't forget, all our latest news and updates can be found on our social media channels, X, LinkedIn and Facebook.